Okay, well, I'm going to get started with my introduction. Good afternoon, everyone, and thank you for attending IPHA's third Lunch and Learn web series. My name is Jenna Heyer, and I'm a member of the IPHA Education Committee. So we're glad you're here, and this session is being recorded, and it will also be posted to the IPHA YouTube channel. Just a couple housekeeping items. Your microphone should be muted during the presentation. This will just help with the general bandwidth and everything else that comes along with that. But you can put questions in the chat or the Q&A feature on Zoom here. So we will also have time at the end for live discussion, and feel free to take yourself off mute at that time, turn on your camera, and engage in dialogue with us if you'd like. So today we're joined by Anne Crotty with the Iowa Department of Health and Human Services. So Anne, I am going to let you introduce yourself, and again, we'll just kind of recap and have time for discussion and Q&A afterwards. Thanks for being here, Anne.
Thanks, Jenna. Yeah, so my name is Anne Crotty. I'm the Americans with Disabilities Act coordinator, and also with Iowa Health and Human Services, I'm working on compliance with the Americans with Disabilities Act and also disability inclusion within Iowa HHS and with our external partners, both at the state level and the local level. So it's a big, expansive role. I've been here about 4 months. And so I'm presenting beyond ramps and parking spaces, including people with disabilities. Okay. I want to talk a little bit about inequities that impact people with disabilities, some tips for disability etiquette, how the culture of health can create or reinforce bias about disability, and, oh, yeah, same one. So to talk a little bit about statistics and the demographic population of people with disabilities, about 23% overall of Iowa's population has a disability, and prevalence increases with age. And so keep this in mind as we talk about the rest of the presentation, that eventually every one of us is going to have a disability. So think about some of these inequities and how you might experience them if it's yourself or a child or an aging parent or a close friend. Virtually every one of us is going to have someone that's important to us be navigating this system. And there are also disparities among people of color and people with lower incomes that are disproportionately represented among people with disabilities. And in Iowa, the most common types of functional disabilities are people with mobility disabilities, like challenges walking upstairs, and cognition, like understanding or making decisions. Ooh, okay. I'm not sure if this is going to work, but I have a little Slido thing about, so when you think of disability, what comes to mind? You can go to the slido.com or use the QR code and enter the 1757585, and we'll come up with like a word cloud. I'll give people a minute to do that. Anything else? Or you can just put it in the chat too.
If anyone puts it in the chat, I'll just continue to add it. So.
Thank you. Yeah, so this is really interesting and what I was expecting, honestly. Yeah, but a lot of understanding that people with disabilities are often overlooked and have challenges interacting with our environment. because our environment is just not accessible. And also there's a lot of different types of disabilities, although some disabilities are a lot more obvious than others. Like that invisible term, there are lots and lots of people with invisible disabilities where we don't know if they have a disability or not. It's not obvious, of course, and so it's hidden. Oops. Okay, and then want to talk too about some of the different terms that you hear in the health equity space. And so exclusion is where people with disabilities are totally set aside, they feel like they're not welcome. Society is not including them, or they feel like they don't have a place. Segregation might be where they are separated. Or integration is where they might be technically included or technically involved, but still don't feel like they belong or are accepted within a group. Inclusion is where people might be accepted, but don't feel like they truly belong. And then belonging is when people do feel valued and respected and appreciated for the gifts that they bring and the experiences they bring. And you notice for belonging, there are the little happy faces too. So that belonging and inclusion are what we're really striving for people to have the option to do that. And then also allowing opportunities for affinity groups, like grouping of people with disabilities as they want to group in those situations. Also, I want to talk about the difference between equity and equality. These are some terms that are sometimes thrown around a lot, but sometimes people don't know what the exact differences are. And I came across this example too from the Robert Wood Johnson Foundation. We've seen the bike example where everyone has a different, everyone for equality has the same bike, even if it's not the bike that works for them or is practical or what they need. But then in equity, everyone gets the type of bike that they need. So this example is on the left, you have people crossing a street, and it's a curb, but there's no curb cut. There's no way to know if it's safe to cross the street or not. And on the right side, you have like a curb cut that lots of people are using, not just the people with disabilities, and also the traffic signal that uses multiple modes of telling people that it's okay to cross with both auditory and visual outputs. And so everyone benefits there, not just those with disabilities. And a little bit more about the specific term inclusion. I'm using the definition from National Center on Health, Physical Activity, and Disability. It's transforming communities based on social justice principles so that all community members are presumed competent, are valued and welcomed as community members, participate and learn with their peers, and have reciprocal social relationships. And some of the microaggressions that I've come across in the disability space are when people, like strangers, just come up to people at the line at Walmart and say, "Can I pray for you?" Assuming that someone feels like they're broken and need to be prayed for, The next one on being brave and inspirational. People with disabilities should be able to be just like everyone else, and assuming that someone is brave and inspirational just because they have a disability and are living their life is offensive. They should be able to have an off day just like anyone else. Another one that I want to pull out too is you're so lucky to not have to work. This is offensive on so many levels too. There are so many people with disabilities that are excluded from employment right now, or underpaid, or underemployed, and to have the assumption that it's nice for them to not have to work. And then finally, just the idea about asking a companion of someone with a disability, what do they want to eat, and assuming that they can't talk or have their own preferences. Even if someone has an intellectual disability or might have difficulty speaking, we still need to assume that they're going to have their own preferences. Some inequities among people with disabilities. About 56% of physicians would welcome a person with a disability as a new patient. This is shockingly low. And we might think that this was a study from like decades ago. This one was from 2021. There are still a lot of gaps for physician training and healthcare provider training in general on interacting with people with disabilities and familiarity with various conditions that can cause disabilities. Women are less likely to receive preventative care like mammograms and pap smears. A big reason for this is due to the lack of adjustable equipment like exam tables that are not adjustable, or mammogram machines that are not adjustable to allow them to receive mammograms. And then also things like weight scales. I've heard from lots and lots of people that use wheelchairs that they haven't been weighed when they go to the doctor in decades, which is shocking. Also, people with IDD, intellectual and developmental disabilities, are about 7 to 9 times more likely to be sexually assaulted. A big reason for this is because people with IDD are often not intentionally taught what is a good touch and a bad touch, and taught about their own sexual health. And in some cases, that's intentional too, because their family members are assuming that this person is not going to be in sexual situations, or they're not interested in sex. And so we don't need to talk about it, or it'll be awkward. I don't know how to talk about it. And that puts them at extremely high risk for being sexually assaulted. Also, increased prevalence of things like obesity, smoking, diabetes, and intimate partner violence. And some social determinants of health factors: are less likely to be employed, more likely to live in substandard housing, even after controlling for income, less likely to be married. There's I believe it's called Work Without Worry bill right now in the State House that is hoping to address this issue about the marriage penalty, where people with disabilities are penalized if they get married because the amount of benefits that they can receive is drastically cut, and limited just by getting married. And that also means that they're less likely to be employed as well, because it limits assets that they can accumulate and benefits. And then finally, just more likely to rely on often inadequate transit systems or rides from other people. And I want to talk about this slide too, and spend some time on this one. So thinking about, why do these inequities exist? There are a few different schools of thought. It seems like the medical model is kind of where we are right now, and also in the past, where people with disabilities are seen as broken or need to be fixed, and the problem is internal to them. But then the wave of the future, and where we're trying to get to, is and seeing that there's nothing wrong with people with disabilities. It's the society on the outside that is inaccessible. And if society were accessible, then the disability would almost disappear. And then also on the outside, you also have things like stereotypes and rigid procedures and practices, inaccessible communication, and things like that. Does anyone have thoughts about this slide? You can put it in the chat. Or unmute yourself too, I guess.
I really like it overall, and I think it really shows the differences of the norms that we speak in.
Mhm. Thank you. Okay. Yeah, it's a lot to take in on this slide. So also, I think it's important to think about how might the cultures of health and medicine create or reinforce bias about disability? Does anyone have ideas off the bat?
I think that this potentially speaks to what you mentioned earlier, just about how physicians wouldn't even consider taking someone with a disability as a new patient simply because they had that disability and then potentially weren't trained in school about how to care for that individual. And so if the provider is expressing concern about whether they're willing or able, doesn't matter which, that sort of culture needs to then change within how we're instructing those medical professionals to engage with 20% of the US population that identifies as having a disability.
Mhm. Yeah, you're exactly right. Does anyone else have thoughts? That's the way it's always been done. Okay, so I have some other ideas too. Okay, so thinking about quality of life, health, the Institute of Medicine says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And this definition of health is foundational within the profession of medicine, by the way, too. This is like pretty much the first thing that medical students learn. And not just medical, but also public health students and other professions. But I want to know, does anyone feel like they can ever truly be 100% healthy? For myself, I would say I should probably eat more vegetables. Maybe I could get more exercise than I get all the time, you know? But there's an assumption within this that because people with disabilities might not meet the definition of what the healthcare provider is thinking, and they see visual disabilities or like obvious disabilities, outward disabilities maybe, then they're making a judgment that these people with disabilities have a lower quality of life than those folks with disabilities report themselves. Another example or separate area of implicit bias, ableism. So ableism creates an environment that's shaped for only normal bodies. So the belief that everyone wants to hear and should hear and would suffer if they can't hear. And also an assumption that if someone is using a wheelchair, that their greatest wish might be to walk. Whereas I would say that maybe instead of assuming that the greatest wish would be to walk, assuming that, say, wheelchairs were affordable, more affordable than they are, or also things like wheelchairs were treated with care when people travel. Does anyone else have thoughts on this slide or other examples?
For me, the first thing that comes to mind is our chairs and how chairs are shaped. Are there armrests that are too close together that won't allow all people of all sizes to fit into?
Mhm. Yeah, good point. And it's a lot more difficult or expensive to get those adjustable chairs, right? So just lack of flexibility.
Right, exactly. Or even thinking about airplanes too, like it's all about the environment.
Mhm. Another one is the belief that disability equals disease and illness. So just because someone might have a disability, even if it doesn't cause pain or illness, healthcare providers and sometimes even public health sees people with disabilities as impaired, or diseased or things like that, sick, needs to be fixed. And a lot of people are proud of their disability and would not choose to become normal if they had the choice. So I feel like it's been very life-changing and gained perspective that otherwise they might not have had. Any other thoughts on this one?
That's a really good point. I think I totally agree with this. Everybody is just used to trying to fix everything, and we don't know how these other people feel, and maybe they don't want to be fixed. They just want to be included and treated with respect. So
Yeah.
this is it's a great way to look at it.
Mhm. And I look at these pictures too. I'm using some pictures from there's an inclusive image library in Inclusion Connection is an inclusive image library, and I've also collected some from Pexels, which is a free image sharing site. But I just look at these folks and they're powerful pictures of people with disabilities feeling included in the community and just loving life. The kids on this picture, I love them. And some
Can
of
you
them have accommodations, like the boy with the headphones, but
can you repeat those resources you have to find that?
oh, so I do have a
Inclusion.
slide later
Okay.
with the links, but it's pexels.com is a free image sharing site. And then Inclusion Connection is another one, but I can send you the links too.
Thank you.
And I also think that very often we individuals with disabilities or special needs from the society or from their families, which can also be part of society, are put an emphasis on them being normalized or them being into the normal role of other children when they're young or other adults when they're older. And that puts an impression on the person with disabilities that they want to be like others because they want to make their families or society happy.
Mhm. Yeah, I think it was so about the concept of internalizing ableism. Even someone with a disability can internalize the pressure and beliefs about disability from the rest of society. So yeah, good point on that. Any other thoughts? Okay. And I wanted to talk to you about some factors that are impacting our work in disability justice space. So first of all, the direct care workforce crisis, of course, is huge. But it's impacting things like if someone with a disability, say they depend on someone coming in to help them get out of bed and use the restroom and get dressed in the morning so they can go to work or school. Depends on a caregiver coming in to help them do those things in the morning. There's such a shortage of those folks to come in right now because people can make a higher wage by going to work at McDonald's, as an example, than being a caregiver of that type, that a lot of those caregivers don't stick around very long as in that workforce. It's also difficult work. Sometimes it's not glamorous, you know, you don't get a lot of training. Yeah, challenging though. And so if that person cannot get up and go to school or go to work, that puts their job in jeopardy and their degree too, or their schooling. And then that also increases the percentage or the chance that they'll have to go to an institution because their needs cannot be met in the community, which is, of course, is illegal, but it is what's happening in our state right now. And also intergenerational neurodivergence. So this is where you have kids now that are like in the school system and they might be diagnosed with autism, but then their parents too, and going through all of the material about what is autism and the, yeah, thinking that maybe I kind of see myself in this too. But when I was a kid, I was not treated with care. I didn't get any supports and services for autism. I was told, you're a bad kid, you can't listen, you're doing this intentionally, you know, things like that. And so a lot of parents are really struggling with that sometimes too. Also, some cultural shifts. So the shift from disability rights to disability justice and intersectionality. Disability rights movement didn't really include the needs of people of color, as an example, and the people with intersecting identities. It was very white focused. And so disability justice is an attempt to include BIPOC individuals and LGBTQ people with disabilities and groups like that, that also have greater disparities that are not met otherwise. Shift from institutions to community living. And then also the concept of independence, I feel, is kind of a loaded concept within the disability field anyway. So this is recognizing that everyone has worth, everyone has something to teach, and also something to learn. And that we all are depending on each other at some point in our lives. So like I'm well into adulthood and I still go to my parents when I need to make a really big decision. And I still go to them for support. And I think we need to take out the assumption of, because you're labeled as independent, you know, you don't depend on other people. Does anyone else have thoughts about that?
It's almost like taking the I out of independence and making it like inter. You know,
Mhm.
it's not just all on me. I'm a visual, so I'm seeing that, take the I out, make it inter. So I don't know.
Yeah.
It's good.
Yeah, we all depend on other people. Even if we say that we're not dependent on them, we need others. And then also it's kind of a loaded concept too, and very Western centric. Like I used to work with someone that her son is 22 now. He just aged out of the child system, but they're a Latino family and they are being forced to, in order for him to receive services from the state, he would need to move out of his family home. And that's, of course, not supportive and not in line with the Latino culture. And the family doesn't want him to move out. They don't want him to have to give up that piece of his culture. But yet that's what's being forced by our state government right now. So. Okay, I want to get into a little bit about disability history and also the Americans with Disabilities Act. These are some pieces of legislation that impacted the disability field. Back in 1867, we had the first ugly law that was passed. That was in San Francisco, where people with disabilities were not allowed to be in public. And they were fined between $1 and $50 for every instance. That led to forced sterilization and institutionalization, of course. In 1962, Ed Roberts sues to attend college, and Ed Roberts is the person on the left there in the picture. In 1964, we have the Civil Rights Act, but it excluded people with disabilities. And then later we had Medicare and Medicaid and the Voting Rights Act, and then Judy Heumann too, who's the person in the middle in this picture. She sued New York State to become a teacher. She had been previously designated as a fire hazard, is what they called her, as the reasoning that she couldn't attend school at that school or become a teacher. And then 1974, the last ugly law was repealed. So that was just over 100 years when those were enacted. Capital Crawl and the Americans with Disabilities Act were in 1990. And then an ongoing disparity are things like the marriage penalty that I mentioned before, and also we still have some sheltered workshops. We're trying to switch away from those. And then this is a picture and quote from Judy Heumann, where it just says, disability only becomes a tragedy when society fails to provide the things that we need to live our lives. Job opportunities or barrier-free buildings, and it's not a tragedy to me that I'm living in a wheelchair. I love that quote, and it's so powerful. And then the picture is of an 8-year-old girl, Jennifer Keelans, I believe, or Keenans, who got out of her wheelchair and she climbed up the Capitol steps because the Capitol building was not accessible to her. That was at the Capitol Crawl. A few basics about the Americans with Disabilities Act. The purpose is to make society fully accessible, of course, and to make sure that people with disabilities have the same rights and opportunities as everyone else. Responsibilities for state and local governments are to prohibit discrimination based on disability and provide reasonable accommodations to make programs or services accessible. We can't deny or force participation in different programs. And then there's a few different sections of that, and I'll pull out some of these to talk about them more. So effective communication is obviously really important, and I'll talk more about that in a little bit, but then reasonable modifications could be big or small modifications, of course, but a lot of things like just providing documents earlier, or providing support before and after meetings, or providing a captioner during a meeting, things like that. And if you want more assistance with this or more resources, I'd be happy to meet with you. This is part of my role as the Americans with Disabilities Act director for HHS. Oh, one more thing. So building a culture of full participation and belonging, this is the area, kind of like a gray area, it's not as concrete as some of the other ones, but the culture of full participation and belonging is also a responsibility of the ADA and something that we need to focus on. Universal design goes back to that curb cut graphic that we've had at the from the Robert Wood Johnson Foundation earlier. So it's a process of creating products that are accessible to people with a wide range of abilities and needs. And it's also recognizing that even if someone doesn't have a disability, these changes are still going to be helpful for them, you know, so curb cuts are helpful to someone that's riding a bike or pushing a stroller. Automatic doors are helpful if someone is carrying a really heavy box, stuff like that. But they're also essential for people with disabilities. Some language choices to both use and avoid. So handicapped is definitely a word that I would not use in the future. Instead, use accessible. The word or the phrase struggles with is another statement with a judgment attached to it. So again, it's not up to us to decide if a person is struggling with a disability. You just say person with a disability and maybe that specific name of a whatever disability they have. Instead of developmentally delayed, it's a person with an intellectual or developmental delay. And then another example I've heard sometimes is like confined to a wheelchair or wheelchair bound. Instead, use person who uses a wheelchair. And a big point on this one is that a wheelchair is not something that's confining someone. It's a tool to live the life that you want to use. You know, it literally someone's legs. Right? Does anyone else have thoughts on this part?
I think it's good there just to be able to be and willing to be corrected in those moments. I think that it's good to have these choices, and obviously there are those that are preferable. I use a wheelchair myself, and I even heard just last night, confined to a wheelchair or wheelchair bound. And when talking with that person, it was just nice that they were receptive to hearing that, oh, that there is this other preferred option, and that they would certainly then use that going forward. I think that's just an important thing, to really be patient with people if they do kind of make those missteps, and then gently correct them, so it's not like a big deal or anything like that.
Yeah, thank you, Ben. And then on the term birth defect too, something I've noticed is instead of, this is another judgment, you know, but instead of judging, instead of having the judgmental birth defect term, be as specific as you can about the name of a disorder or the name of a disability. Or if you don't have the opportunity to say the name of a specific disorder, you can just say a congenital disability. Some tips for disability inclusion. A big thing here is to budget for accommodations ahead of time. It's going to be a lot easier to provide those accommodations if you have some money to assume that at some point you're going to need to provide an interpreter or a captioner or some workplace accommodations or things like that. Also include pictures of people with disabilities in your meeting materials. This goes a long ways to making people with disabilities feel like an event is for them and they're wanted to be there. Check in with people with disabilities that are attending before and after meetings to offer support. Offer or provide meetings ahead of time and to allow especially someone with an intellectual disability or that uses a screen reader to load it onto their computer to make sure that they can read it. Include people with disabilities as early as possible in planning or implementing programs, and also make sure that you provide the tools and support to make sure that they're successful. You don't want to include them just as a token measure, of course. And also there's an example at Siouxland District Health Department. They started an Inclusive Health Coalition, really cool group that it's been operating for several years now. But I would love to see inclusive health coalitions at many different health departments at the local or state level. Some disability etiquette. Definitely use plain language and summarize long documents, and use person-first language or ask people's preference. There are some people with disabilities that prefer terms like disabled. Disabled is called identity first language. And the interpretation that I heard from this is that they prefer that term because they're disabled by society. And so that really resonates with me too, when you think about the social model of disability too. Whereas person first language is saying disability is a part of me, it's not my whole identity. I'm a person first. So both of those are valid, of course. So just use what an individual has as their preference. Always talk to the person with a disability and not their companion. And I used to work with someone that had a speech disability, and it was sometimes difficult to understand him, but it was extremely important to him that people not just nod or try to get by if people couldn't understand him. So always ask a person to repeat or rephrase or write it down if needed. That's just going to help them feel included, of course. And then always don't assume that someone with limited speech can't understand. They know if they're being talked about behind someone's back. Some tips on how to create an accessible document. You want to use the sans serif font. And sans serif fonts are fonts like I have on the screen, where it doesn't have little feet at the end. A font with feet is like Times New Roman. Sans serif fonts are a lot easier to use. If it's a printed document, try to use at least 12 to 14 point font or larger font if you know someone has a vision disability and they need large print. Don't use only color to convey info, like important information is in red. There are lots of people with color blindness that can't see that important information. And this is just a screenshot on how to conduct an accessibility check on a PDF document. And I also have one for Word, but this is a question I get all the time. It's really simple. And I would say these tools, the accessibility checkers, aren't perfect, but it's a really good, easy way to start. If you're new to creating accessible documents, start there as an intro step. And this is also something I can provide more info on or help with if you want in the future. This is a screenshot from Microsoft Word. It's just a bar at the top of your screen. It says check accessibility, and then it brings up on the right side all of the issues that you have to fix. And some of them too are really easy to fix, and then others will take more time. So it's not as overwhelming as it looks. Finally, I just call everyone to be a disability champion. This is a graphic from the Centers for Disease Control and Prevention that suggests we acknowledge and respect individual experiences and abilities, learn about different disability types, leverage our own influence to promote accessibility and inclusion, and yield the floor to people with disabilities to help identify and eliminate barriers and amplify their voice. These are some resources that I've compiled about disability. And I'll send these slides out as well. And finally, I just want to remind everyone too that so disability is natural. There is a natural variation in abilities and skills, and we'll all have a disability at some point. So really need to think about the service system and the supports that we would want to use someday when we all have disabilities. We don't know when or who it will be in our life that has a disability, but we will all be navigating this system someday. So some references. And finally, my contact info for questions. Does anyone want to unmute themselves or put thoughts in the chat?
And I have one thought. First of all, this was really informative, so thank you. One thing I'm thinking about is kind of with the history you went over. I think there's so many people that maybe aren't aware of that history. And, I've been in the field of public health for a while, and I haven't had a lot of training on disability bias. It's been mentioned, but it makes me think about if we need to do something, when we're onboarding staff in terms of educating them on disability bias. And I don't know if anyone else on the call, like maybe others have have those kind of processes in their departments, but that's just one thing I'm thinking about. Is there anything else that we can do in terms of education? Like, are you able to give presentations to local health departments face to face or things like that?
I think I could. I am doing a presentation for Warren County Health and Human Services next week.
Okay.
So I think that's probably something I could do. I am working on a statewide presentation though, because this Warren County situation was a request from long ago. But I think this is a need across the state. So
Absolutely.
I'm working on a statewide presentation on disability. And then we've also talked about wanting to do a kind of a community of practice, like office hours type thing, where
Okay.
the Office of Health Equity staff for Iowa Health and Human Services would schedule maybe 2 hours every few weeks or something like that, where we could just invite anyone to come. And I don't know how expansive this would be. I don't know if it would be beyond state and local public health staff, if it would be open to partners at this point, but allow them to come with their difficult health equity questions or problems and say, this is my problem, or this is my project, this is what I'm struggling with, this is the type of resistance I've gotten. Let's strategize on how to address it, and it could also include more folks than just disability folks. And that would help allow all of us to learn collectively about intersectionality and gain health equity skills at the same time. Would that be helpful?
That sounds wonderful to me. Yeah, I would love to be involved in more of that. And I just, I came into this session not really thinking that I was lacking as much knowledge, and now I'm realizing I was. So like I said, it was very useful. So I have that interest in getting more information now and kind of passing that along. So
I agree with you, Jenna. I also think it's very, very good information that we all need to think about. It's not the first thing we think about when we think about health equity by any means, but it needs to be at the top of the list.
Right.
And I agree that a type of education process like this would be advantageous to have before you brought these individuals together, for them to give you their concerns, because they may not even know, what, in Dubuque County, we have, through the county, we have a disabilities coordinator that it would be a resource. But at every area of the state, health departments have a resource person that, like, when new board of health members come on, they have to have an education. So could they incorporate those individuals into also being able to give this kind of information
So
to new
I'm not
staff?
sure I'm totally understanding. Can you explain more?
Well, so when, the question was when new staff members come on board, is there a type of inclusivity and equity and disability information that could be given? And so when we onboard new Board of Health members, they all, according to state code, need to have we have area coordinators that give education to those individuals. Well, could that also include new staff members? And could they not just do exactly what they're doing now, but could they include a little bit more so that when they come to the table to ask questions about how to do these things, they at least understand the background that you would be giving?
Mhm. Yeah, so Dan, I'd love to follow up more with you about that and talk about that. I think we could work something out. Maybe we might have to figure out how, within the processes for, you said Dubuque County?
Well, Becky Novacek is in Dubuque County.
Okay.
She has our area. And so whenever there's a new Board of Health member come on, she is the one that does education for them, but she's also a resource person for the whole health department.
Mhm.
So could she include more?
Yeah, I think so. Yeah, so this training that I'm doing for Warren County is actually targeted to the Board of Health, but they're also broadening it to include a whole bunch of other local staff. The Justice Department is invited apparently. So I think we could figure that out, but I would like to talk with you more about that. So maybe can you put your email address in the chat?
Yes.
Okay, thank you. Any other thoughts or questions?
As a mom with a child with living with disabilities in the school system, one of the biggest challenges I find is that teachers and administrators do not see, there's a lot of disability bias, I guess, that is present. Has this type of thing ever been offered to educators when we're addressing the social determinants of health? Education is one of the big ones. And it's a huge barrier. So I was just curious because I feel like this is very valuable information because it's so implicit within our systems. So just curious.
Yeah, I don't know to what extent all of this information has been shared with educators. I would guess some of them maybe have received some of the information, but yeah, it's a good point. I don't know which organization too would be the one that would share some of that. I know the Iowa USED is involved in some education work. It's more along the lines of like Judy Worth's work with making sure that like youth employment, So, but it's not as much sharing the implicit bias information. But it is a gap. You're right. Any other thoughts or ideas on how to meet that or address that gap, or know of organizations that might be interested if we could reach out to them, or have other thoughts in general?
And one other related thought, but because I saw one or two people jump off, I'm putting I put a evaluation link in the chat. So if everyone could take that, that would be great.
Thank you. Within the school or the education system, I do know that Ask Resource Center does a lot of advocacy and education for families with disabilities on like education rights and things like that. So I don't know, they might be an organization that might be in the right place maybe to help coordinate that or know of a resource maybe. Thank you, Jenna.
Mhm.
I haven't really found that Ask does it much within the school system as far as that goes, but that's just been my experience.
Yeah. It might be something that we'd have to do it ourselves. You know, if there's nobody else doing it right now, then that's an opportunity for us to work on. Or a partner to step in with. Yeah, thank you, Liz, for the training. Oh, and also thank you to, was that Lena maybe or Kim for the Judy Worth shout out. Judy is going to be the closing speaker at the public health conference next week. Oh, thank you, Kim.
You bet. We're excited to have Judy with us next week.
Yeah, she is such a fabulous, powerful speaker. I know some of you know her personally, but I love talking with Judy. She's the best person about just making people a little bit uncomfortable in a good way, a way that makes you question assumptions and think about things in a different way. So I really encourage you to stick around for that presentation if you can at the conference.
Thank you, Anne.
Mhm. Any other thoughts or experiences? Yeah, so the comment from Christine Pinter too about, she says, made the concept of moving from independence to interdependence made me think of the importance of having and building a supportive community and the barriers at play for building one. So thinking about the term for a supportive community might be a term like natural supports. So when people with disabilities don't need anything special or don't need official supports, but the people in their lives understand what their needs are and just are able to provide those supports naturally is what we want to work towards eventually.
Thank you for making that differentiation. I like that term.
It's the most inclusive too, right? It's what everyone wants. Okay.
All right, well, thanks again, Anne, for sharing your expertise. I think I can just tell the way, you know, this was something that was really valuable for a lot of us. So next month in April, you'll actually be seeing my face again. I'll be presenting with a few others from North Iowa to talk about a unique solution to the childcare crisis in Iowa and what we are piloting up in Saragordo County to help with our childcare shortage. So I hope you can join us for that. And like Anne and Kim said, hopefully we will be seeing a lot of you at the Public Health Conference of Iowa next week as well. So we're always looking for more people and potential topics for future Lunch and Learns. So feel free to reach out. There are plenty of opportunities for those interested. You can email an IPHA staff if you have any ideas, and their contact information is on the website. So, and then like I said at the beginning, this presentation will be posted on the Iowa Public Health Association YouTube channel. So you can find on there any webinars you may have missed as well. So check that out as well. And then, like I mentioned, if you could just take a few final minutes to complete that evaluation link. And that wraps up our Lunch and Learn. So thanks again, and we'll see everyone next month.
Kim, do you know how, should I just send you my slides or how do we get those out?
Sorry, my mouse wasn't working with me. Yes, if you just want to send them to me, I can make sure that they get uploaded.
Okay,
Perfect. Thank you so much, Anne. We really appreciate it.
thank you.
All right. See y'all later.
Here, everyone. Bye-bye.
Bye, thank you.